Hello, I am Dr. Rajasekar, MD nephrologist from Chennai, Supra Health Clinic. I have been experienced in my field for the past 5 years, and I am very interested in hemodialysis and care, as well as peritoneal dialysis and care. So I want to discuss about guidelines for eating and drinking habits for the hemodialysis patients. Your choices about what to eat and drink while on hemodialysis can make a difference in how you feel and can make your treatments work better. Between dialysis treatment sessions, wastes can build up in your blood and make you sick. You can reduce waste buildup by controlling what you eat and drink. You can match what you eat and drink with what your kidney treatments remove. Some foods cause waste to build up quickly between your dialysis sessions. If your blood contains too much of waste, your kidney treatment sessions may not remove everything, so you may need to go for additional dialysis sessions. Or with the same dialysis sessions, your waste products will be within the blood and can cause your ill health. Your diet is an important part of your treatment. Your kidneys cannot get rid of enough waste products and fluids from your blood, and your body now has special needs. Therefore, you will need to limit fluids and change your intake of certain foods in your diet. The kidney dietitian at your dialysis center will help you plan a diet for your special needs. So, what you should eat and how the drinking habit can be affected in hemodialysis patients. So, when you are in hemodialysis, you need to take a restricted amount of water, as that amount of your drinking will be accumulated in the blood as the kidney fail to excrete the fluid adequately. When you are on hemodialysis, your food and drink preferences can impact your treatment and how you feel after undergoing it. Between two sessions of your dialysis, waste and toxins can accumulate in your blood, making you feel sick. However, you can keep this accumulation under control by following a proper renal diet. You can balance your diet with that what dialysis tend to remove from your blood and prevent waste and fluid buildup. If you are getting started with hemodialysis, you need to make certain changes in your diet and lifestyle. Needless to say, what you eat in a day is a crucial aspect of your treatment. Therefore, it's highly advisable to get in touch with renal dietitian to plan a special diet for you. As far as standard diet of hemodialysis is concerned, here are some of the vital points to be considered. Make sure to include high protein food items in your diet, because the protein loss is very high in dialysis sessions. So you need to replace whatever proteins has been excreted in the dialysis sessions need to be replaced with a high protein diet. So when you are going hemodialysis, you need to take around 1 gram per kg protein has to be taken. If you are undergoing peritoneal dialysis, you may need higher protein like 1.5 gram per kg protein you need to supplement. Make sure to consume foods that contain low level of sodium and low level of potassium, because that high level of potassium intake will be retained in the blood and it can cause heart problem as well as increased heart rate or alterate in the arrhythmias can be happen. Whereas if you take more amount of sodium, that can cause more fluid retention as well as more amount of increased blood pressure. So you need to have less sodium and less potassium intake. Then another one thing, that high level of phosphorus foods should be restricted, because the phosphorus whatever you take will be excreted only by the kidney. Where the kidney is not excreting, there will be phosphorus accumulation will be very higher. That leads on to a lot of bone disease as well as vascular diseases as well as heart diseases. So learn how much fluid you can safely drink, which includes coffee, tea, water, and any food that in the liquid form at the room temperature. So as already salt and sodium, so you should always use herbs, spices, and low salt flavor enhancers in place of salt. Avoid salt substitutes made with potassium. That example is one thing is rock salt. So use only the table plain salt. Avoid rock salt. So when you come to the protein, that you can take a meat. So people on dialysis need to eat more protein, as already explained. You have to take 8 to 10 ounces of high protein foods every day. So the preferred proteins are like meat, fish, poultry, fresh pork or egg. And those who are vegetarian, they can go for paneer and other vegetable proteins. So grains and cereals and breads, they are essential servings of a carbohydrate replacement. So you have to take adequate energy. For that, carbohydrate is the main source. Unless you need to limit your calories intake for weight loss and to manage carbohydrate intake for blood sugar control, you may need as your desire for the food group like grains, cereals and bread. Most people need 6 to 11 servings from the group each day. So when you come to milk, yogurt or cheese, limit your intake of milk, yogurt and cheese as they contain high phosphorus contents. Whatever types of milk, like it may be skim milk or low fat or whole milk, everything contain high amount of phosphorus. So those things you should be limited within the half cup or 1 cup per day. So when you come to the fruits and juice, all fruits have some potassium, but certain foods have more than the others and should be limited or totally avoided. So limit or avoid oranges or orange juice, kiwis or prunes and fruit juice, raisin and dried fruit should be avoided, as well as bananas, which must avoid as it contains more amount of potassium. So these with food, all the restrictions, if you maintain, your dialysis session will be pleasant and you can live healthy and with good health. Thank you.